Which of the following is a potential protective mechanism against AKI during cardiopulmonary bypass? A. Use of non-pulsatile perfusion. B. Increased dose of heparin to prevent clot formation. C. Mild hypothermia to reduce renal oxygen demand. D. Elevation of blood pressure to improve renal perfusion. Answer: C. Mild hypothermia to reduce renal oxygen demand. Explanation: mild hypothermia, 28 to 32 degrees Celsius. During CPB is thought to reduce the metabolic demand of renal tissue, thereby decreasing the likelihood of ischemic injury and AKI. Hypothermia decreases the oxygen consumption of kidneys and other vital organs, protecting them during periods of reduced blood flow. Other interventions such as non-pulsatile perfusion and high-dose heparin may not offer the same level of renal protection. Which of the following is the most significant factor in determining the need for renal replacement therapy, RRT, after cardiopulmonary bypass? A. Urine output. B. Serum creatinine levels. C. Electrolyte imbalances, e.g., hyperkalemia. D. Fluid balance. Answer: C. Electrolyte imbalances, e.g., hyperkalemia. Explanation: the most significant factor in determining the need for RRT in AKI following CPB is the presence of severe electrolyte imbalances, such as hyperkalemia, that cannot be corrected with conservative treatment. Elevated potassium levels can lead to life-threatening arrhythmias, making RRT essential for clearing excess potassium and other toxins when renal function is severely impaired. What role does the use of biocompatible materials in the extracorporeal circuit play in preventing AKI during cardiopulmonary bypass? A. It enhances renal perfusion by increasing blood flow through the circuit. B. It reduces the inflammatory response and endothelial activation. C. It promotes the clearance of waste products from the blood during surgery. D. It minimizes blood loss and transfusion requirements. Answer: B. It reduces the inflammatory response and endothelial activation. Explanation: biocompatible materials in the extracorporeal circuit, such as coated tubing and oxygenators, are designed to reduce blood activation and the inflammatory response. By minimizing contact activation of blood cells and the release of pro-inflammatory cytokines, biocompatible materials can help decrease the incidence of AKI related to the inflammatory response triggered by CPB. Which of the following is the most common histologic finding in patients with AKI after cardiopulmonary bypass? A. Glomerulonephritis. B. Acute tubular necrosis, ATN. C. Interstitial fibrosis. D. Focal segmental glomerulosclerosis. Answer: B. Acute tubular necrosis, ATN. Explanation: the most common histologic finding in AKI after CPB is acute tubular necrosis, ATN. ATN results from ischemic injury to the renal tubular cells, leading to cell death and dysfunction. The loss of tubular integrity leads to a decrease in the kidney's ability to filter waste and maintain fluid balance. Which of the following interventions is least effective in preventing AKI during cardiopulmonary bypass? A. Use of pulsatile perfusion. B. Preoperative use of nephrotoxic agents. C. Avoidance of excessive hemodilution. D. Maintenance of adequate blood pressure. Answer: B. Preoperative use of nephrotoxic agents. Explanation: the use of nephrotoxic agents prior to surgery, such as nonsteroidal anti-inflammatory drugs, NSAIDs, or certain antibiotics, can increase the risk of AKI, especially in patients undergoing CPB. Nephrotoxic drugs should be avoided before surgery. On the other hand, pulsatile perfusion, avoiding excessive hemodilution, and maintaining adequate blood pressure are effective strategies to minimize AKI risk during surgery. Which of the following can result from the use of high-dose vasopressors in patients with AKI after cardiopulmonary bypass? A. Improved renal perfusion and kidney function. B. Increased risk of ischemic renal injury. C. Enhanced glomerular filtration rate, GFR. D. Reduced need for renal replacement therapy, RRT. Answer: B. Increased risk of ischemic renal injury. Explanation: the use of high-dose vasopressors can lead to increased systemic vascular resistance, which can worsen renal perfusion by causing renal vasoconstriction. This can exacerbate renal ischemia and increase the risk of AKI. While vasopressors are sometimes necessary to maintain blood pressure, they should be used cautiously, especially in patients with pre-existing renal risk factors. Which of the following postoperative factors is most strongly associated with AKI after cardiopulmonary bypass? A. Hypovolemia and inadequate fluid resuscitation. B. High-dose sedatives and analgesics. C. Lack of postoperative physical therapy. D. Early ambulation and respiratory support. Answer: A. Hypovolemia and inadequate fluid resuscitation. Explanation: hypovolemia and inadequate fluid resuscitation postoperatively are major risk factors for AKI following CPB. Insufficient volume replacement can lead to renal hypoperfusion, exacerbating ischemic injury to the kidneys. Proper fluid management is crucial to maintaining renal function and reducing the risk of AKI after surgery. Which of the following factors best predicts the long-term renal recovery in patients who develop AKI after cardiopulmonary bypass? A. Duration of the CPB. B. Age of the patient. C. Extent of renal injury as indicated by urine biomarkers. D. Type of cardiac surgery performed. Answer: C. Extent of renal injury as indicated by urine biomarkers. Explanation: the extent of renal injury, as assessed by urine biomarkers, such as kidney injury molecule 1, KIM1, or neutrophil gelatinase-associated lipocolin, NGAL, is a better predictor of long-term renal recovery in patients who develop AKI. Biomarkers provide an early, sensitive measure of kidney injury and can help guide prognosis and decision-making for further management. Which of the following is a primary goal of managing AKI following cardiopulmonary bypass? A. Initiation of early hemodialysis. B. Prevention of further renal ischemia and fluid overload. C. Aggressive administration of diuretics. D. Use of nephrotoxic medications to support renal function. Answer: B. Prevention of further renal ischemia and fluid overload. Explanation: the primary goal of managing AKI following CPB is to prevent further renal ischemia and fluid overload. This involves optimizing hemodynamics, maintaining adequate renal perfusion, and carefully managing fluid balance. While diuretics can help manage fluid overload, aggressive use without proper monitoring can lead to electrolyte imbalances or dehydration. Which of the following is the most effective approach to prevent AKI during cardiopulmonary bypass in patients with pre-existing chronic kidney disease, CKD? A. Use of high-dose corticosteroids. B. Maintaining strict glycemic control. C. Minimizing the duration of CPB and aortic cross-clamping. D. Restricting fluid intake postoperatively. Answer: C. Minimizing the duration of CPB and aortic cross-clamping. Explanation: for patients with pre-existing chronic kidney disease, CKD, the most effective way to prevent AKI during CPB is to minimize the duration of CPB and aortic cross-clamping. This reduces the time during which the kidneys are subjected to ischemic conditions. Limiting ischemia and ensuring good perfusion are key to protecting renal function.